You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest in studio today is Dr. David Haase. Now, David's joined us in Australia to attend the third Bioceuticals Research Symposium 2015, and he's agreed to tell us about his research and what's going on. Welcome to Australia, David.
Wayne, it's great to be here. I enjoyed the hospitality of this country already.
That's splendid to hear. Now, I understand that your work looks at understanding the role of inflammation of the gut and the brain and how that may affect the diagnosis of depression. Can you explain how that links together for us?
Certainly. It starts with a fascination of being curious about just how does our brain work. Isn't it a remarkable thing to ponder? And, oftentimes we're so consumed in the day-to-day of living, of thinking, of feeling, that we don't sit back and say, how is all this happening anyway? And depression is a single condition that we can look at as a model of understanding a more broad way of this brain, body, being thing we call life. And so what we've done is to step back and say, what is depression? What is depression on a definition of a more robust nature? For instance, is it just a symptom that we name it and then we want to blame the depression for the problem and then we tame it with the drug? Or is depression a biochemical reality, which we can certainly start to measure various molecules that indicate indication of underlying causes of depression. Simply such as like a B12 deficiency or a thyroid hormone deficiency. Or is it even an electrophysiological manifestation? The brain is an electrical organ, and we can measure the brain waves and compare those against FDA-registered databases to have an understanding of what is the set point of this individual that's sitting with us that is plagued with this very profound symptom of depression. And so there are things called alpha waves, and an asymmetry, for example, of these alpha waves from the right hemisphere to left hemisphere is a well-defined and well-described marker for depression. So we can look at depression from the brainwave standpoint. And then stepping back and saying, some individuals are just fine until they encounter some type of a biological challenge, something that raises their inflammatory state. We see this with individuals who are given interferon alpha for the treatment of hepatitis C. Many of these individuals will go into an acute depressive state. And isn't that curious, right? That wouldn't be a psychological thing.
It is indeed curious.
And so if we're fascinated by, what causes this, you start to dive into literature and recognize that many markers of inflammation are predictive of how intense a depressive episode will be in a susceptible individual. So it's not all individuals that become depressed as a result of an inflammatory burst, but those individuals who have a genetic susceptibility, maybe a sociological or psychological susceptibility, but that's the tipping point that takes them over.
So, David, is depression common in Australia, or is it common, for that matter, around the world?
It's a worldwide epidemic, and it's increasing in every location. And I think that has probably more to do with the export of McDonald's and the Western style of eating and the increased stress load and decreased sleep and increased 24-hour-a-day light exposure and odd sleep cycles. There's not a single reason for depression to occur. It's not like you're catching a virus, right? Like I caught the cold, I caught depression. No, it's a multifactorial causation with many nuances in its actual expression. And the point of the the seminar that I'll be leading at the third Bioceuticals Symposia this year, Friday, Saturday, and Sunday of this week, is really to step back and say, how can we be more curious? And I find I certainly don't have all the answers. I found some new answers, but it's so much fun as a physician to, again, get to be curious, not just to be constrained with what the pharmaceutical model would tell us is the approach to depression, but say, is there a way we can look from a scientific standpoint to more accurately assess reality and thereby produce better results for our patients and, frankly, more joy of practice for ourselves?
Now, it does seem to me that when we start to talk about issues of the brain, the various specializations are almost mutually exclusive. You know, the talk therapy people don't tend to get involved with the same stuff that neurosurgeons get involved with, and don't tend to get involved with the same stuff that other specialties get involved with. Is your approach more holistic than is traditional?
Wayne, that's a brilliant observation you've made there, because the brain is our organ of bias, right? All of our understanding of the world is our bias. And we all have a bias. It's essentially what makes us human. Bias kind of gets a negative connotation, but we all have a bias.
Yep.
And no matter what we do every day, that actually grows a brain that gets better at doing that every day. So if you're a surgeon, you're going to keep looking at structure. If you're a psychologist trying to understand the brain, you're going to look at its story. If you're a sociologist, you're going to look at the systems that person lives in. And it goes on and on and on, depending upon the bias at which you bring to trying to understand this incredible phenomenon we call a brain and cognition. And so, yes, my approach is it's not an approach that's trying to be honest about the biases that exist and say, which would be the best approach for this particular individual? Is it a biochemical approach? Is it using neurofeedback? Is it using a biochemical evaluation of the gut, of neurotransmitter function, of inflammatory status? It's instead saying, how do we find the right tool for the right job? And it's a wonderful exercise to continue to ask this question and occasionally get an answer.
You're listening to Health Professional Radio with Wayne Buckler. My guest in conversation is Dr. David Haase, who is here in Australia to speak to the Bioceutical Conference on the weekend. Now, this is an opportunity, I guess, David, that we don't normally have to talk to someone who's a world-leading expert in this. What are the causes of depression and what can people do to reduce those levels, in your view?
Well, number one, if we think about depression, the first thing we have to recognize that it is a symptom. And it's not a thing in and of itself. It is a very real symptom, and it is life-limiting on phenomenal levels to individuals who are so afflicted. But if we look at the symptom and have it drive better questioning, then we have more possibilities to find the solution for ourselves as an individual. So every symptom I feel is meaningful. It's the body crying out to say, something is wrong here. Please find the cause, and address that underlying cause. So that being said, there's several things that are common causes. Number one, sleep deprivation. This is something I'm experiencing at the moment, although not depressed. The flight to Australia is quite a time turner in one's physiology. So much of our reality is based upon day-night cycles, and getting light during the day and enjoying complete darkness at night is quite important. And we see this also with individuals who have a seasonal affective disorder, more depression during the winter time. So just exposure to light can be really remarkable. Secondly, exercise. We make serotonin in a place called the dorsal raphe nucleus and the ventral raphe nucleus. These are the two areas in the brain where we make serotonin, the quote-unquote happy chemical. It is made predominantly in those areas and released during movement, during exercise. And never has there been a more effective, consistently effective therapy than exercise for depression. Again, eating lots of leafy green vegetables. Mother was right, eat your vegetables. And those leafy green vegetables will have lots of B12, folic acid, and other nutrients that are important in preventing depression. It's seen very clearly by population studies that individuals who have higher levels of these in their bloodstream, that comes from diet or supplementation, have fewer issues with depression. There's multiple nutritional supplements that may be appropriate for a particular individual. One of them is SAMe, S-adenosylmethionine, has been shown in head-to-head studies versus pharmaceuticals to improve mood and actually joint pain. So the list goes on and on, because the cause of depression is not the same for everyone, and it's usually a multifactorial cause, not a singular cause.
Now, David, there's a close association between depression and suicide, as I understand the statistics. This is a life-limiting condition. Do you think the things you've been suggesting, which are, essentially diet and exercise, is this sufficient to deal with something that is so threatening?
I think when you're saying the word sufficient, we always have to be careful, because I don't believe we ever really hit that level in healthcare. When we can only know that through a device called the retrospectoscope, right? We can, that device that allows us to look back in time, like I should have done this or I should have done that. I will say that what I advocate is something called no alternative medicine. It means that there's no alternative to getting enough sleep. There's no alternative to eating great food. There's no alternative to getting enough sleep if you want to experience your fullest health potential. And so whether or not it's enough, that we can only know in retrospect. However, let me tell you about a study I'm going to be presenting. And this is a study looking at the brains of individuals who had committed suicide. And they took these brains and actually sampled the level of inflammatory markers in the brain. And individuals who were depressed versus not depressed had a dramatically different pattern of inflammatory molecules in areas of the brain that are central to mood regulation. And so individuals who committed suicide versus depressed individuals who did not commit suicide versus normal controls, it was profound how much more inflammation in the brain the individuals who committed suicide had. And I think with our current pharmacologic single interventional model, we're missing the boat on potentially helping people through a multidimensional approach to depression, which includes looking for, first of all, acknowledging depression as a cause, then looking for underlying causes of depression, of inflammation, and then going after those individual causes of inflammation, many of which tend to be centered in the gut, because that's where a large majority of our immune system lives. So individuals who change their diet, of note, individuals who are sensitive to gluten, once they get off of gluten, is profound the changes in mood that occur for those particular individuals. So if you're asking, is it sufficient? It is not sufficient, but it is certainly necessary.
It sounds, David, like a fascinating study. Now, I am under pressure from the clock here, so let me ask you what I guess is my favourite closing question. What do you think is the greatest misconception amongst patients, clients, clinicians about depression that drives you nuts and keeps you awake at night?
The greatest misconception is that depression fell out of the sky and hit them on the head, or that depression was caused by a single event, not triggered maybe by a single event in the context of their entire body, brain, being reality. That's what drives me crazy. And if individuals can grasp the fact that they have incredible potency to heal and to shift their mood state from many different angles in our healthcare armamentarium. That's what I hope for them, that they would recognize how much potential they have to thrive.
Dr. David Haase, it's fascinating to talk to you, and I'm sure the participants at the Bioceuticals Research Symposium on the weekend will also enjoy hearing from you, and with a little bit of luck and some grace on your side, maybe some of that misconception amongst those people will be alleviated by hearing what you've got to say. I'm sure the audience will be absolutely rapt at the presentation of your research and your encyclopedic knowledge of the issue, as it sounds to me. Can I say thank you for appearing on HPR? We've appreciated the time with you.
Wayne, it was a delight to be with you and to be in Australia. You have a phenomenal country here.
Thank you very much. On behalf of the country, I'll take the credit. You've been listening to Health Professional Radio. A transcript of this interview and an audio archive is available on our website at www.hpr.fm. This is Wayne Buckler for Health Professional Radio.